Good morning, Hikana Washte. I'd like to greet all the listeners, the community members, and the patients this morning. I am Jana Gipp, the CEO for the Standing Rock Service Unit. The Standing Rock Service Unit comprises of the Fort Yates Hospital and direct patient care clinics that are located in Fort Yates, the McLaughlin Clinic. We have a Wakpala, Cannonball, and Bullhead Satellite Clinic. That comprises our whole service unit. I want to explain the reason for our session today. We felt as a leadership team that we wanted to get information out to the public to let them know or advise them about our processes and the things that we are changing on a daily basis. I reached out to some people, mainly the Community Development Corporation here in Fort Yates and the PATH group, and they were so helpful in getting this session started. So I want to thank them for all their assistance. I'd like to talk briefly about what we're doing to make our patients and staff safe. The nurses are screening. If you come to the clinic, you'll notice either clinics in McLaughlin or Fort Yates, you'll notice that nurses are screening all the patients at all the direct care patient areas with the most current screening tool that's sent out by CDC. Nursing is also screening all of our staff. All the staff are going through one door every morning at McLaughlin and in Fort Yates and in the emergency department. All staff are required to wear PPEs, the personal protective equipment, to protect themselves and the patients. I'm going to let Dr. Tincher update you more on all our clinic process changes. I also would like to update everyone on the communication we've had with the tribal leadership. We have been working with the tribal leadership for the past at least 6 weeks to 2 months on the COVID pandemic. The tribal health director has been meeting with our leadership team on a daily basis for weeks and weeks. Our leadership team has been meeting with area office and with headquarters on process changes and current recommendations on how we are to handle this pandemic. So we've been planning for a long time. We also, myself and the medical staff have been over to the tribal council meetings, at least 4 meetings now so far, where we've updated the tribal leadership and tribal directors and district officers on all the information that we have on the COVID pandemic. We also have calls with the tribal chairman, and the tribe has instituted a tribal IC team, and they have members there, and they are meeting on, all of us are meeting on an ongoing basis. The tribe has really helped us in providing information out to the communities. Everything that we get from CDC or from the Department of Health or from headquarters, we've given to the tribal health departments, and they have dispersed that information to all the communities. In the absence of the radio station, that is the only way we were able to get information out to the communities. I just want to talk about HIPAA a little bit. As healthcare providers, it's really important for us to protect the patient's privacy. So if there is a positive that we test, we will not be disclosing that information to anybody unless the patients themselves release the information. They allow us to release that information. Currently, the state is reporting age, county, and how they were exposed, whether they're traveling, community acquired, or contact acquired. And when they are positive, when there's a positive, the state will be contacting the tribal chairman, and without giving any details, they will just be notifying him that if there's a positive in his counties, and he will make the announcement on his own. The Indian Health Service will not be making any announcements on any positives. Also, I want to say that the state, when they do have a positive, they do their own investigation, and at some point they will engage the Indian Health Service to step in and assist with that investigations, and we will also be making contacts with those patients as much as we can. If we hear that those patients need assistance or are quarantined and they need food or supplies, we will be providing them with information on how to contact the tribe. So they will not be coming through us for those types of things. They will be going through the tribe. I know the tribe right now is working on getting that information out to the public on how they can be contacted if there's resources needed. As what we can provide to you though is that so far we have tested 39 patients, we have 0 positives, we have 29 negatives, and we have 10 pending cases. Carson County, the state has reported that Sioux County has 1 case and that Carson County in South Dakota has 0 cases. The next person that will be speaking will be Dr. Amber Tincher, who is our clinical director, and after that, George Walker, our safety and infection control officer, will also be presenting today. I just want to let the listeners know and the community members and our patients know how hard our staff is working. Everyone is taking other duties and taking other responsibilities within our facilities to address this COVID-19 pandemic. I also want to give a shout out to the tribal health staff who is working around the clock, and to the incident command team members who are also working around the clock to get processes in place to address this pandemic issue and be prepared. I would like to encourage everyone to listen to our session, which will be every Wednesday at 3 o'clock. It will be available on our Facebook page and will also be available on YouTube. Thank you, everyone, and please stay safe.
Good morning. My name is Dr. Amber Tincher. I'm currently the acting clinical director here in Standing Rock. My portion of the questions today is basically to answer some of the medical concerns from the community. I'm just going to start by addressing what we're doing at our clinic. And it's our job to keep patients safe and to keep our healthcare workers safe. And so we've made some changes in just basically how we perform medicine. We're not trying to limit services. We're just changing how we're performing those services. People will notice when they come to our doors that we have some locked entrances now. We're trying to control the flow of what's entering our hospital. The only door that patients can get into is our front door, where they will be screened by a nurse, checking them for any symptoms of COVID, mainly like the cough, the fever, shortness of breath. If those patients have those symptoms, we're putting a mask on them, and then we're bringing them back to an area where we're screening for COVID. And so that's kind of the first way that we're keeping staff and patients safe. You'll notice that there's not a lot of people sitting in our waiting room because we're trying to just get them back into rooms right away. Our pharmacy, we're delivering most of the medications out to the parking lot, so we're minimizing traffic that way too, as far as just people sitting in our waiting room. Jana explained what we're doing with staff, where we're screening them through the back door, monitoring for any symptoms every morning, including fever, because we want to keep sick staff out of here too. We have temporarily closed our satellite clinics because we felt like we couldn't control that environment quite as well. We want to remind people that, if you are out in those communities like Bullhead, Cannonball, and Wakapala, we still want to ensure that you're getting your medications. What you got to do is just call in, ask for refills, and right now we're looking past, getting labs if we don't feel like they're 100% necessary, or that if we can wait a couple months. So we're doing 60 to 90-day refills on most chronic medications. We're getting them out to the community, and we're trying to either deliver them by out in the parking lot or mail. So again, we're trying to minimize how many people are coming into our facility and trying to keep people safe by not having to come here. Our ED is locked. You have to hit a button to get in, and they'll screen you right at the door as well. We're running what's called a COVID clinic. So like I said, if you're having symptoms when you come in, they're going to mask you and they're going to bring you back to our clinic. We have what's called a negative pressure room. So it kind of sucks the air out of there. It helps exchange and keep it a safer environment. So we're trying to screen most of our patients in that room. And if you qualify for a test, then we'll do the test. So when I say like what qualifies you for a COVID test, a lot of that comes from the state health department. And you have to meet a certain criteria of symptoms. And if you meet those certain symptoms, we can definitely test you. We also have been screening for strep and flu because we're still seeing a lot of that in the community. But if you're a high-risk patient and you meet the testing qualifications, we will swab it and then send it to the state health department. And that's all being done in a controlled environment back there. Us as providers have to wear that personal protective equipment that we talked about too. And we're trying to keep it all in a certain wing of our hospital. We also created a wellness clinic. So our patients that are well, that are coming in for preventative care or like OB care, pediatric stuff or immunizations, we're trying to keep all that in a wellness hallway where we are limiting exposure to those type of patients. So we're trying to make it a safe environment for people to enter. Our McLaughlin clinic is still open. They're doing similar things. They don't have one of those negative pressure rooms, but they're doing the same thing with the entrance, the pharmacy, and then designated rooms for testing. So that's kind of a clinic update. Our eye clinic is emergency only right now, and so is our dental clinic. And those are following national guidelines during this COVID. That some of those are risky situations. So some of those services have backed off, but they're emergency only. Our ED is open as usual. But again, some of the screening process might be a little bit different, just trying to keep the sick away from the unsick patients. We do have a COVID hotline. So if you guys haven't got that number out in the community, it's 854-8331. And that's how, if you feel like you have experiencing symptoms, you call that number. It'll go straight to, we have a COVID doctor and a COVID nurse, and we have a schedule pulled up. And so we'll just fill you into one of those slots that we feel that is open, and we're screening people through that. Typically, we're having those patients meet us at a certain door so we can, again, control the environment of what we're bringing in. Along those lines, what are the symptoms of COVID? The biggest one we're hearing is fever. That's probably number one. It's not in all the cases though, so just because you don't have a fever doesn't mean you don't have it. We're seeing cough, shortness of breath, sore throat, minimal congestion. Typically, if people are congested, they're thinking more allergies, but it is showing up in some of these cases. Also, GI symptoms, so nausea, vomiting, diarrhea is actually popping up in some of these cases. When is it an emergency? Is when you are very short of breath, persistent pain in your chest, which could be, burning from your lungs. Then you need to present to the emergency room or call 911. Confusion, that's usually a sign that it's maybe more progressed. Or, if your lips are turning blue, that means you're not getting enough oxygen to your body. Who should be tested? I kind of went over that. We follow the guidelines set forth by the Department of Health. They're also prioritizing when facilities are running low on tests, which is happening in our whole country. They're prioritizing healthcare workers, those that live in communal settings, those that are hospitalized, and healthcare investigations, so exposures of people that were also positive. It's a nasal swab. It goes, straight into your nose and way back. It's a little bit uncomfortable, but it's similar to the influenza swab. How do you protect yourself is another big thing. Right now, we're saying, the social distancing, and everybody's working on that. Stay home when you're sick is a big one. If you are sick, wearing, the surgical type masks, which are the ones with the loops around the ears, those protect other people. So say I have COVID and I put one of those masks on, I'm protecting everybody. Every time I sneeze, every time I cough, it's staying inside my mask. me just wearing a mask and going to the store with one of those little loop ones, that's not 100% going to protect me from getting it. It prevents me from touching my face. But remember, that is the big thing, is if you're sick or you're having any type of symptoms, those help contain it into that mask. They're saying 6 feet is kind of the distance. So if you're somewhere and you're closer than 6 feet to somebody, you should probably back up. The best prevention for COVID is just not being exposed. So limit how often you're going out. You got to protect our elders because they're the ones that are really affected by this. So, I know that we like to gather socially, and the big thing is we just delay it right now. It's not a good time for big social gatherings. This is spread by, they're thinking mostly respiratory droplets. So when you sneeze, it sprays into the air, and people, you can either breathe it in, or if I sneeze into my hand and I touch a doorknob and then the next person touches a doorknob and touches their face, they can get it into their nose, their mouth, or in their eyes. And that's how they inoculate themselves and become infected. The good news is the virus is pretty easy to kill from what they're seeing. You got to use soap. Soap disrupts the virus and it breaks it down. Alcohol, our hand sanitizers. And so we got to make sure we're using these often. And then again, don't touch your face, cover your mouth when you sneeze, kind of the basics that we learn. Stay home if you're sick. If you're sick, you shouldn't be out at the grocery store shopping. Have somebody do all that stuff for you. And then cover your cough and sneeze. Remember, if you're sneezing, to sneeze into your arm and not on your hand or into the air. How do we keep this out of our house, or how do we clean our house when this gets into our home, or cleaning our surfaces? We can use common household agents. Since we're having a hard time buying some of the Lysols and the Clorox bleach wipes at home, you can use isopropyl alcohol as long as it's 70%, and that can clean some of your surfaces. Remember to hit surfaces that you touch often, so your countertops, your light switches, your doorknobs, and then limit people in your home, because if you're being really good and you're not going anywhere, remember that the virus can't just travel on its own. It needs people to help it travel. So the only way to stop this virus in its track is to stop traveling or stop being around other people. So if you're being really good, you can have somebody bring it into your home. So really try to limit your guests at this time. And I think that's it for cleaning that I have. Just remember to wipe those surfaces, like I said. Next, I just want to hit on treatment quick. The easy answer is we don't have a treatment for coronavirus. It's a novel agent, so it's a novel virus, which means it's something new, and we don't have a vaccine for it yet. Vaccines can take years to make. They're trying to push one out in a year, but that's not soon enough for us right now. So the best medicine that we have for this virus at this point is staying home, socially isolating. Again, keeping that virus from moving from the next person to the next person. It needs people as a host. They are looking at some of our old medications that we've had in medicine to see if they're helping this virus. And right now, it sounds like there's some studies that are showing, and they're small studies that are showing possibly some improvement, but again, there really isn't a good treatment for this. That's all I have for everybody today. Again, we're going to be doing these every Wednesday. Please submit your questions. There's a lot of information that's coming out on this virus that's coming out every day. We're trying to stay educated on it. So we'll try to stay up to date. We want questions to keep coming from the community because we want to keep people informed, and we want to, number one, keep everybody safe. Again, just stay at home as much as you can. That's our biggest message, but we are here to help you. Talk to us if you're concerned about coming in, and we'll do whatever we can to get you the care that you need. Thank you.
Okay, good morning, everyone. My name is George Walker. I do safety and infection control for the Standing Rock Hospital here in Fort Yates, along with grievances, and I also do employee health. So just a couple recommendations that we're doing since this time of pandemic that we're having with the COVID-19. We're stressing the importance of social distancing among our tribal members and our community members, which means stay at home, practice respiratory etiquette, hand hygiene, respiratory masks, or if you have masks, wear those. If you don't have masks, then wear something like a handkerchief or a Kleenex. You can wear those. Cough into your sleeve. And then again, practice hand hygiene with hand sanitizer, or if you have a bar of soap, go ahead and use that bar of soap for at least 20 seconds, soap and water. Okay, so PPE. PPE is personal protective equipment. That is equipment that's designed to protect the healthcare worker. So here at the hospital, we have N95 masks, which is a thicker, heavier mask that's designed for the healthcare worker. We have surgical masks, we have gowns, we have face shields, and we also have gloves that we use. Those are stocked in our property and warehouse, and we have them in departments of the hospital. Every morning and afternoon we meet and we get numbers. We have like an Excel program or a sheet that we have, and basically it tells us what products we have, what might be we getting low on that we can order through. As far as ordering, we have a number of vendors that we use, vendors and manufacturers that we use. We have the National Supply Center that we use, which is a federal facility that we use for supplies. We also have direct contacts with companies where we can order supplies. And then also, lastly, we have the North Dakota and the South Dakota Department of Health. They have like a HUN assets or a cash supply that we can use. And on that it's just a web-based program. It's like shopping on Amazon where you can just click submit and then they send you stuff. So for the PPE, personal protective equipment that we have here, so far we are, like I said before, we are sitting really good on that. We have a number of supplies that we are sitting better than most facilities. And when, like I said earlier, we just work again on grabbing or getting that product before and watching to see if we're getting low on certain products. Now I'm going to talk about what happens when we get our first case here in the community. So what we do is we do testing, and you got to realize that when we do testing, it's not immediate test results that we get back. It's usually a day, 2 days behind. So when we do get our first case, we also got to assume that this has been in the community for a while. Just because we got our first case, or just because we have no cases, excuse me, doesn't mean that it's not in the community. We just probably haven't tested enough people to have them positive. So we are again stressing the importance, because right now we have no positive cases, but we're only started testing maybe approximately 39 people, 40 people. So we want to stress the importance of social distancing, which means stay in your house, protect yourself, you and your family. And by that, you can practice, again, CDC guidelines of proper respiratory etiquette, washing your hands with soap and water for at least 20 seconds, and using hand sanitizer. Again, if you do not have any surgical masks, then you can use a handkerchief, you can use a Kleenex or a scarf, or maybe even a sleeve of a shirt, or even the possibility of an old shirt. As long as you use that to cover your cough, that'll be protecting others. Okay, these are some of the questions that have been provided us from the community. The first question one of the persons asked is, the state says one COVID case in Sioux County. Is that person native, white, or where in Sioux County are they? So when we do any reportable conditions, whether it be the North Dakota or the South Dakota Department of Health, privacy is our #1 priority. We don't give out any information to the general public of where they live, what their race is. The only thing that we provide that goes out to the public is the age of the individual, the sex of the individual, and in that county where it was identified. Another question that we had is, what procedures are you guys taking for the safety of workers? So for approximately, I think we're going on our 3rd week now, we've screened all our patients and our employees also that present to the hospital. So for screening questions that we ask our patients, they're just simple travel questions that have been developed by the North Dakota Department of Health that we ask. Sometimes might include fever, have you traveled here, have you traveled there, any signs, symptoms, stuff like that. Also, we ask those same 3 similar questions to every staff member that presents to our facilities in the mornings. And we also take their temperature. And then based off that, there's a flow sheet that the North Dakota Department of Health has developed that we follow. And on that, for our employees, it basically gives us a step-by-step of what's the next step that we need to do with that employee. So I'll read 3. What are the chances that a Standing Rock Sioux Tribe employees who commute from Bismarck-Mandan are possible carriers of the COVID-19? So what we do, again, back to that last question that I just had, is we screen all our patients that come in. We also screen all our employees, along with taking temperatures of those employees. And the tribe has gone to essential staff only, where there's no one coming and going. So as far as someone coming in and going out, as far as IHS, we screen all those employees. All our employees are screened prior to coming in the facility. And then another question that I had, someone had asked, is there any way to get masks or gloves for myself and my family? So we, as the IHS facility, we are not giving surgical masks away to the general public. If you come in and there's a criteria that we have that would require us to provide you with a surgical mask, then we are. But right now we are not giving those away. I know if you can try to find them online order, you can order them online, or maybe for some foreseen future, maybe the tribe may get some masks where they decide to hand out. But right now, surgical masks are hard to come by. Even us, we have a daily grind of, we always have stockpiles, but we're always trying to get more and more and more, and there's just a back order on all of them. So what I would suggest is, again, social distancing yourself, which means moving away from everyone if you can. Also practice the respiratory etiquette, coughing in your sleeve, coughing in a Kleenex, throwing that away, hand sanitizer. And again, if you don't have hand sanitizer, use soap and water for 20 seconds. Also, there's other alternatives to a surgical mask. You can Google and look online how to make some. You can use a handkerchief if you have one, a bandana if you have one, and then also you can use a scarf if you have one. Or you can also take a shirt and cut that shirt up just enough where you can tie it around and cover your nose and mouth.
So the first question that I got was, if we think we have the virus, do we need to go to the hospital or stay home? We're hearing both. This is where I talked kind of earlier about this. If you're having mild symptoms, you can stay home. If you do that, you need to socially isolate. You need to keep away from other people in your family and try to contain this just to you. If you want to be tested or you feel like you're getting more ill and you need to come in, call that coronavirus hotline, again, 854-8331. And you'll talk to a nurse or a doctor. We'll kind of guide you through some of the symptoms and see if you qualify for testing. And if you do, we'll meet you at one of the entrances, bring you in, and we can test you. If it's emergent symptoms, then you need to call 911 or present to the emergency room as soon as you can. And some of those, again, are shortness of breath, pain in your chest, trouble breathing, or the lips turning blue, confusion. Those are some of the symptoms. So my last question is, does Standing Rock Sioux Tribe have enough beds to treat patients, or will patients be transferred to Bismarck hospitals? So if we have a patient who is sick, but we feel that they don't need to go on a ventilator, they're breathing on their own, we just want to monitor them and ensure that they're getting better, we have the capabilities of caring for those patients here in our hospital. So if it was one of those, doesn't need to be intubated, we'll keep them here. If they start to decline, we're going to transfer them up to Bismarck. Bismarck is working on a plan where they're trying to make as many ventilators, ICU beds, and all that available. And I'm sure you guys have seen this in the whole entire country. That's the problem with this, is if everybody gets this virus at the same time, we're going to run out of capacity to care for all the ill patients, especially the ones that need ventilators. We do have one ventilator here in Standing Rock, and that would only be used if, say the scenario that Bismarck completely overflows and they don't have any vents left, then we're going to have to care for those people within our own facility. But again, that's going to be kind of our last plan. And if we get to that, then we have a plan in place where if we get to that point, we'll go there. But right now we'll care for the less ill patients here, and then be sending the rest up to Bismarck if we feel like they need a higher level of care or intensive care, as long as those beds are available in Bismarck.
How is the Standing Rock IHS service unit partnering with and coordinating with the tribe to educate members about COVID-19 symptoms and how to prevent exposure? As I had mentioned earlier, we are meeting with Tribal Council whenever they call us over to update them on all the new CDC information that's coming out, the North Dakota Department of Health information that's coming out, and we're updating them on any new processes that are happening within our facilities. We are meeting daily with the Tribal Health Director. She gets on the calls with us every day. and she is also the incident command chief. She is communicating with us on their incident command center processes, and we're working on those plans on a daily basis. I've had calls with the chairman and had calls with a few councilmen, so we are getting the information out to the public that way and through the tribe. The second question I'm going to be answering today is, how is the Standing Rock IHS service unit ensuring that people in the community who don't have access to Facebook or the internet are receiving information about COVID-19? So what my answer to that question is that the tribe is providing information out to the communities from the IHS Facebook page and handouts that we are providing to patients when they present to our facilities. That's how we're getting information out currently, and through this Zoom session that we are going to have on a weekly basis. Until the radio station gets up and running, when that gets up and running, we will be trying to utilize the radio station. We also provided a PSA. We'll be providing a PSA to the Teton Times with important information for community members. I would like to thank everybody for listening today. I hope that you all tune in every week with us at 3 o'clock on our Facebook page, Indian Health Service Facebook page, and it will also be available on YouTube. Everyone, please stay safe and follow the recommendations that we are providing in this Zoom session. Thank you.